وياكم anatomy because the anatomy is the important aspect in every surgery. Gallbladder lie on underside of the liver at the junction of the right and left lobe of the liver. The relationship of the gallbladder to the liver is differ from person to person. Sometimes the gallbladder is embedded within the substance of the liver substance, or may be supplied by a mesentery between the gallbladder and liver. The shape of the gallbladder is a pear shape. طولها تقريبا من 7.5 إلى 12 cm, variable طبعا, with a normal capacity of about 35 to 50 ml. The anatomical division of it is composed of from fundus, body, neck, and terminate into infundibulum, then to the cystic duct. This is a picture of the gallbladder that show the blood supply of it and cystic duct. The cystic duct is about 3 cm in length, but it's variable. يعني من كل واحد اللينث مالتها 1.5 cm, 1 cm. Okay, it is within normal. It is lumen is usually about 1 to 3 millimeter. يعني ال diameter مالتها 1 to 3 millimeter. Above this ممكن نقول dilated. Its wall is surrounded by sphincter structure called sphincter of Loschkin. While the cystic duct join the common hepatic duct, مثل ما تعرفون إنه biliary system of the start by intrahepatic biliary tree اللي هي biliary canaliculi that attach together from the left lobe, left hepatic duct, right lobe, right hepatic duct. When it is joined together, form the common hepatic duct. Okay, this common hepatic duct, when the cystic duct of the gallbladder attached to the common hepatic duct, form the common bile duct, اللي هي CBD. Okay. May be extend down the insertion of the cystic duct to the common hepatic, usually to the supraduodenal segment, but it may be extend down into retroduodenal or even retropancreatic part of the bile duct or common bile duct before joining. Okay, the common hepatic duct is usually less than 2.5 cm, يعني 2.5 cm. الcommon hepatic اللي تتكون منين؟ من الرايت والليفت hepatic duct, and it's formed by union of the right and left hepatic duct. The common bile duct اللي تتكون منين؟ تتكون من الcystic duct تتصل بالcommon hepatic duct is about 7.5 cm long and is formed by junction of the cystic and common hepatic duct. The division of the common bile duct is composed of 4 parts. The common bile duct, supraduodenal portion اللي هو تقريبا 2.5 cm above the duodenum, retroduodenal portion, and infraduodenal on the posterior surface of the pancreas, and intraduodenal من تدخل بالduodenum حتى to be inserted to the ampulla of water, will pass obliquely through the wall of the second part of the duodenum, where it's surrounded by sphincter of Oddi and terminate by opening the ampulla of water in the second part of the duodenum. The gallbladder supplied by a cystic artery, which is a branch of the right hepatic artery اللي هو يجينا منين؟ يجينا من common hepatic artery اللي يجينا منين؟ من celiac artery. Occasionally there is individual variation. 15% of cases the right hepatic artery and or the cystic artery cross in front of the common hepatic duct and the cystic duct. The most dangerous anomaly are where the hepatic artery takes a tortuous course on front of the origin of the cystic duct, or the right hepatic artery is tortuous and the cystic artery short. And this is make a difficult identification during cholecystectomy, the removal of the gallbladder, because the surgeon is considered this tortuous and long artery is considered it as a cystic artery, and I get it during procedure of cholecystectomy, leading to the dangerous bleeding. This tortuosity or abnormality or anatomical variation called caterpillar tear. Regarding the lymphatics of the gallbladder, the lymphatic vessels of the gallbladder drain into cystic lymph node called lymph node of the land. This lie in the fork created by junction of the cystic and common cystic duct and common bile duct. The subserosal lymphatics of the gallbladder also connect with the subcapsular lymphatic channel of the liver. خلص الاناتومي نجي what is the function of the gallbladder? Biles as it leaves the liver is composed of 97% of water, 1 to 2% of bile salt, and 1% is bile pigment, cholesterol, and fatty acid. The liver excretes bile at the rate estimated to be approximately 40 or 40 ml per hour. Okay, تقريبا يطلع 960 ml per day. Okay, the rate of the bile secretion is controlled by cholecystokinin, which is released from the duodenal mucosa. With feeding, there is an increased production of bile in response to the cholecystokinin. What is the function of the gallbladder? The gallbladder is reservoir of bile. During fasting, resistance to the flow through the sphincter is high, and bile excreted by the liver is diverted to the gallbladder. The second main function of the gallbladder is concentration of the bile by active absorption of the water, sodium chloride, and bicarbonate. Okay, by the mucous membrane of the gallbladder, the third function of the gallbladder is secretion of the mucus. About 20 ml is produced per day. So it is a reservoir of bile, concentration of the bile by active absorption of the water and sodium chloride. Third function is secretion of the mucus of the rate 20 ml per day. What are the investigation of the gallbladder? In general, any pathology of the gallbladder should be investigated. It in form of then radiograph, then ultrasound, then scintigraphy, اللي هي HIDA scan, then CT scan, MRI that called MRCP, then ERCP. We take the first plain radiograph. Plain radiograph of the gallbladder will show radio-opaque gallstone, but in a small percent, because usually the gallstone, cholelithiasis, is radiolucent and a rate of some books called 15%, 10%. So it is 10 to 15% of the gallstone is radio-opaque, but it's commonly radiolucent, not shown by plain radiograph. Rarely, the center of the stone may contain radiolucent gas called Mercedes-Benz sign, and the plain X-ray may also show rare cases of calcification of the gallbladder wall called porcelain gallbladder. Okay, the importance of this appearance is an association between the porcelain gallbladder and carcinoma or malignancy in up to 25% of patients. Gas may be seen in the wall of the gallbladder called emphysematous cholecystitis that's shown by X-ray. Gas in the biliary tree may be seen after intervention, surgery, or endoscopic sphincterotomy that go the gas within the biliary tree that is shown by plain radiograph. all these can be shown by radiograph, okay, by simple X-ray. Oral cholecystography and intravenous cholangiography. Oral and intravenous cholecystography are of historical interest only because it is not done today. Why? Because there is another important investigation, another useful investigation other than the oral or intravenous cholangiography. This picture show plain radiograph of the abdomen that show radio opaque multiple stones within the gallbladder. Okay. And this picture show plain X-ray of the gallbladder that shown calcification of the wall of the gallbladder. لو تلاحظ انه الوول boundaries مال gallbladder there is calcification which is called porcine gallbladder, and this is important because it's associated with the malignancy in a rate of 25%. The standard investigation of the biliary system in general is ultrasound. And the transabdominal ultrasound is the initial imaging modality of choice as it accurate, readily available, inexpensive, quick to be performed. However, it is operator dependent. يعني بعبارة أخرى إنه صح هو cheap, صح هو available, صح هو quick to be performed, non-invasive and available and can be portable, but it is operator dependent. يعني تعتمد على اللي يسوي البروسيجر. Maybe suboptimal due to excessive body fat and intraluminal bowel gas. So it is very important to be to examine the biliary system when the patient is fasting to eliminate bowel gas. It can demonstrate biliary calculi. ليش يفيدنا الالتراساوند؟ can show the biliary stone, the size of gallbladder in general, gallbladder size when it is dilated, when it is distended, when maybe there is obstruction. The thickness of the gallbladder wall is indicate there is inflammation and presence of inflammation around the gallbladder, the size of common bile duct, and occasionally the presence of the stone within the biliary tree. Ultrasound can show the stone within the biliary tree, especially in the supraduodenal portion of the common bile duct. In patients who present with obstructive jaundice, ultrasound can identify there is dilatation of the biliary tree, whether common hepatic or even intrahepatic biliary tree. Okay, the cause of obstruction may also be identified, such as gallstone within the bile duct, common hepatic or common bile duct stone, or lesion in the wall of the duct, such as cholangiocarcinoma or enlargement of the pancreatic head, that give idea about the cause of the bile duct by ultrasound. Okay. There is other modality of ultrasound called endoscopic ultrasonography, usually a specially designed endoscope with ultrasound transducer at its tip, which allow visualization of the liver and biliary tree from within the stomach and the duodenum. When do endoscopy, there is a special modality of the ultrasound that attached to the tip of this endoscope to show the liver and within the stomach and the duodenum to show liver, biliary tree, pancreas. Okay, it is useful to detect stone within the bile duct, cholelithiasis. The stone within the bile duct called cholelithiasis. حتى المصطلحات لازم تعرفوها. اوكي، من تقول لي stone within the bile duct صح مقبوله، لكنه من تقول لي cholelithiasis اعتبرك انت قاري المصطلحات الطبيه. اوكي. In addition, it has been shown to highly accurate in diagnosing and staging both pancreatic and periambulary cancer. endoscopic ultrasound have benefit to stage the tumor because it is nearby the tumor. So it is benefit in staging of pancreatic tumor or periambulary cancer. Radioisotope scan, scintigraphy, technetium-99m, labeled derivative of immune diacetic acid called hydroscan. When injected intravenously, selectively taken by retroendothelial cell of the liver and excreted into bile. This allows visualization of the biliary tree. Contrast that injected to the intravenous, selectively taken by liver cells and excreted by bile. This allows visualization of the biliary tree and gallbladder. Non-visualization of the gallbladder is suggestive of obstruction of the gallbladder, especially in acute cholecystitis. If the patient has contracted gallbladder, it's often occur in chronic cholecystitis. In surgery, in any cases of chronic inflammation, so there is scarring and contracture. So in chronic cholecystitis, there is contracted gallbladder. Gallbladder visualization may be reduced or delayed. Biliary scintigraphy, hydroscan, may also helpful in diagnosing of the bile leak after surgery or iatrogenic biliary obstruction. When there is bile leak during surgery, there is injury to the bile duct, maybe there is bile leak. So the biliary scintigraphy or radioisotope scanning have benefit in diagnosing a bile leak of the after surgery, especially iatrogenic. Iatrogenic that done by surgery. Any term of iatrogenic which is happening during surgery by surgeon. When there is suspicion of bile leak following cholecystectomy, a radioisotope image should be performed. Okay? طبعا هاي الانفستيجيشن كلش تفيدكم in any case of biliary lesion. Computed tomography, CT scan, ليش يفيدنا؟ This imaging modality اللي هو قصد CT scan allow visualization of the liver, bile duct, gallbladder, and pancreas. It is particularly useful in detecting hepatic and pancreatic lesion and is modality of choice in staging of cancer of the liver, gallbladder, bile duct, and pancreas. So the CT scan is X-ray, but it is other form of the X-ray. The CT scan have benefit in staging and diagnosing of the tumor of the biliary system. It can identify the extent of the primary tumor and define its relationship to other organ and the blood vessels. So it is have a detail of tumor, staging of the tumor, diagnosing of the tumors, whether in the liver, whether in pancreas, gallbladder, okay? And the relationship of this tumor to the blood vessels or other organ. In addition, in the presence of a large lymph node, there is metastatic lymph node or not. For benign biliary disease, CT scan is not that useful investigation. يعني بالجول ستون مثلا ما قد يعني جول ستون واحد يجينا suspicion of جول ستون نسوي له CT يقول المن مسوي معرضه للراديشن وهو مو قد useful in diagnosing of the benign biliary lesion, especially gallstone. Other form of the investigation called magnetic resonance pancreatography. This is very important than CT scan because it is non-invasive, contrast is not required, and excellent image can be obtained of the biliary tree that demonstrate ductal anatomy, ductal obstruction, structure يعني تضيق, or other intraductal abnormalities. Okay, So the MRCP is more important than CT in diagnosing of the biliary lesion, especially benign lesion, stone structure, other dilatation, congenital abnormalities. Okay. Another modality of investigation هو endoscopic retrograde cholangiopancreatography, called ERCP. This technique remains widely used using a side view endoscope to identify the ampulla of water, can be identified and cannulated injection of water soluble contrast directly into bile duct through the second part of the duodenum, through the ampulla of water, provide excellent image of the ductal anatomy and can identify cause of the lesion, whether obstruction by stone or malignant structure. Bile can be taken to be sent for cytological and microscopical examination. Brushing cytology will be taken for cytology and for histopathology to diagnose if there is any tumor cells or other like structure or tumor. Therapeutic intervention, so have diagnostic elements to diagnose obstruction and tumor, and therapeutic elements such as removal of this tumor or stone or stent placement to relieve the obstruction can be performed. Thus, ERCP has evolved into mainly therapeutic rather than diagnostic, because the diagnostic نقدر نستعيد عنها بالMRCP اللي هو MRI، يقدر يشخص لنا شنو الobstruction lesion، لكنه therapeutic element نقدر نستخدم ERCP to remove this stone, to dilate this structure, or to put a stent. Another investigation, percutaneous transhepatic cholangiography, especially when the obstruction is near the liver or there is proximal obstruction of the biliary tree, need percutaneous transhepatic cholangiography. This is an invasive technique in which a bile duct are cannulated directly through the liver. It is only done once a bleeding tendency has been excluded. يعني إذا المريض jaundice لازم exclude the bleeding tendency because it is invasive. ممكن يصير bleeding من المريض, especially when the patient has jaundice and the bleeding tendency. Antibiotic should be given prior to procedure, to prophylactic antibiotic to prevent infection. Usually, a needle is introduced percutaneously into liver substance under radiological control, either ultrasound or CT scan, or bile duct is cannulated. Successful entry is confirmed by aspiration of the bile, while soluble contrast medium is injected to demonstrate the biliary system. PTC enabled the placement of catheter into bile duct to provide external biliary drainage or insertion of a stent. Preoperative cholangiography during open or laparoscopic cholecystectomy, removal of the gall bladder, catheter can be placed in the cystic duct and contrast injected directly into the biliary tree. The technique defines the anatomy as mainly used to exclude the presence of the stone within the bile duct during cholecystectomy, to exclude slipping of the gallstone through the cystic duct to the bile duct during procedure of cholecystectomy. Operative biliary endoscopy. At operation, a flexible fiber-optic endoscope can be passed down the cystic duct into common bile duct, enable stone identification and removal under direct vision. After exploration, the bile duct tube can be left in the cystic duct, remnant of after exploration of the bile duct, which is nowadays is very rare to explore the bile duct because the ERCP can correct the the 90% of the bile duct lesion. A tube can be left in the cystic duct remnant or in the common bile duct called T-tube, and the drainage of the biliary tree is established after 7 إلى 10 أيام. A track will be established. This track can be used for passage of choledocoscope to remove residual stones. Okay, شباب. خلص investigation and anatomy of the biliary or gallbladder and biliary. Nowadays take congenital malformation of the gallbladder and bile duct. Of the gallbladder, absence of the gallbladder is very rare. The gallbladder is absent congenitally, but failure to visualize gallbladder does not mean it is not found, okay? Because it is maybe obstructed by stone. So it is usually a pathological problem rather than there is absence of the gallbladder congenitally, which is very, very rare. Pharyngeal cap, the second congenital anomaly, which is a benign anomaly, okay, because pharyngeal cap is present in 2 to 6%, which is usually mistaken for a pathological deformity of the organ, but it is not a pathological deformity. Pharyngeal cap refers to heart worn by people of pharyngia. يعني the gallbladder will be long enough to be suspended through the liver. Okay, يعني مثل القبعة الصغير طالعة من الليفر سبستانس والفندس والبدي of the gallbladder is like a cap. يصير بشكلها مثل القبعة. Okay, it is a benign ما سوي لنا فد شيء للمريض. Floating gallbladder gallbladder is provided with mesentery, which make it liable to undergo torsion, which is very, very rare. Okay, there is mesentery to the gallbladder between the liver and the gallbladder, make it to be torted. It's very, very rare, but it is found. Double gallbladder, rarely the gallbladder will be duplicated. So there is 4 anomaly of the gallbladder, which is absence, okay, pharyngeal cap, floating gallbladder, and double gallbladder. Anomaly of the cystic duct, which is absence of the cystic duct. قلنا duct of the gallbladder هي cystic duct اللي طولها up to 3 cm, okay, may be absent. This is usually pathological anomaly and indicate the recent passage of the stone or the presence of the stone at the lower end of the cystic duct, which is ulcerating into common bile duct. The main danger at the surgery is damage to the bile duct within this environment. Okay, when there is a stone within the cystic duct, which is ulcerated through the common bile duct, called Merisi syndrome. Merisi syndrome, which is have types, لكنه واحدة من التايبس مالته, there is a stone within bile duct that erode the bile duct, which is very dangerous anomaly, may make the cholecystectomy is very difficult procedure. Low insertion of the cystic duct. The cystic duct open into common bile duct near the umbilical. All variation of this anomaly can occur. Accessory cholecystohepatic duct. شنو معناها؟ معناها انه there is accessory يعني زايده accessory cholecystohepatic duct. Cholecysto من gallbladder, hepatic من liver. So there is accessory duct between the gallbladder and liver, other than the cystic duct. Duct passing directly into gallbladder from the liver can occur. That the benefit of this duct is causing bile leak after surgery, because it is not shown or not identified during procedure of cholecystectomy. There is accessory duct between the gallbladder and liver. Other anomaly, which is of biliary atresia or extrahepatic biliary atresia. Etiology and pathology of this anomaly is uncommon, affect male and female equally. The extrahepatic bile duct are progressively destroyed by inflammatory process. Progressive inflammatory process affect the bile duct, whatever the bile duct, from the intrahepatic to the extrahepatic. But the extrahepatic mainly, which start around the time of birth, eventually result in the biliary cirrhosis and portal hypertension. Untreated cases, death from the consequences of the liver failure, liver cirrhosis, occur before the age of 3 years. The inflammatory destruction of the bile duct has been classified into 3 main types: type 1, type 2, type 3. Type 1 atresia restricted to the common bile duct, just to the common bile duct. This can be corrected easily. Type 2 atresia of the common hepatic duct, go proximally to the liver, atresia, narrowing. Type 3 atresia of the right and left hepatic duct. It is more complicated because atresia involve left and right hepatic duct. Clinical picture: about 1/3 of the patients are jaundiced at birth in all, but however jaundice is present by the end of the first week and deepening progressively. So the neonate is born with obstructive jaundice. The meconium may be little bile stained, but later the stool are pale and urine is dark, which is feature of the obstructive jaundice. Pruritus is very severe. على الرغم من هو neonate لكنه there is a pruritus and the clubbing of the finger with skin xanthoma. These feature of extrahepatic biliary atresia. Differential diagnosis: any differential diagnosis of jaundice, any neonate given in this aspect. For example, alpha 1 antitrypsin deficiency, cholestasis associated with intravenous feeding, choledochal cyst, and inspissated bile syndrome. Neonatal hepatitis is the most difficult to differentiate it from the extrahepatic biliary atresia. Liver biopsy and radioisotope scan are essential to diagnose and differentiate it from the other differential diagnosis. What are the treatment of the extrahepatic biliary atresia? Patent segment of the proximal bile duct are found in 10% of type 1 lesion. Direct Roux-en-Y hepaticojejunostomy will achieve bile flow in 75%. شنو معناها؟ معناها we connect the patent bile duct to the jejunum to bypass the obstruction, to bypass the atresia segment of the bile duct called Roux-en-Y hepaticojejunostomy. We anastomose the hepatic duct, bile duct, to the jejunum to bypass the atresia segment. يعني نربط البايل duct اللي هي patent بالأمعاء اللي هو الجوجنم to bypass the atresia. Will achieve 75% of flow of the bile to the bowel. But progressive fibrosis result in disappointing long-term result because the process is progressive. يعني inflammation will be occur later on. So the end result of this atresia will be bad prognosis. A simple biliary enteric anastomosis is not possible in the majority of cases in which the proximal hepatic duct are either very small, type 2, or atretic in type 3. These are treated by Kazai procedure. جراح باكستاني اكتشف هذا البروسيجر liver transplantation should be considered in children in whom portoenterostomy is unsuccessful. Post-operative complications of biliary atresia include bacterial cholangitis, repeated attack lead to the hepatic fibrosis, portal hypertension, with 1/3 having variceal bleeding. لهذا الوقت خلصت محاضرتكم، نكمل لكم محاضرة جاية، نكمل الcongenital anomaly of the biliary system، وناخذ لكم the main pathology of the gall bladder and biliary is gallstone. بالتوفيق إن شاء الله. طبعا بس اسم تفاعلي لأن أنتم ما تفاعلتوا والحضور مالتكم هم قليل. إن شاء الله تروح كورونا ونلتقي في المحاضرة ونسأل وتجاوبون وتسألون.